Hello, everyone. Welcome to our True Choices Sexual Integrity presentation presented by Colfs. My name is Kylie Armstrong. I'm the Ministry Operations Assistant at Culture of Life Family Services and Medical Clinic.
I'm Ariana Allen, and I'm the Education Coordinator, also at Colfs.
My name is Nellie Marsh. I'm a registered nurse. I primarily work at Rady Children's Hospital, but I volunteer at Colfs as well.
Awesome. Okay. Okay, so we're going to cover a lot of really great topics in this presentation, just related to how God created you and your body, and for relationship and womanhood and fertility, and all of these really awesome topics related to just living out your sexuality and embracing how God created you. So we just want to lay this foundation and that you understand that you were created for greatness.
So God has an amazing plan for your life, and we think that this plan that he has is best illustrated by the variety and intensity with which the saints live their lives. So we put some different saints here so that we could kind of show you that saints look a lot of different ways. So the first one that we have is Saint Monica. She's in that really pretty icon. So Saint Monica was the mother of Saint Augustine, and he was kind of living a debaucherous life, and she didn't know what to do. So she was instructed by a very holy priest, also a saint, to continue to pray for her son. And she prayed for years and years, and eventually her son did convert and is actually now a doctor of the church, which is one of the highest distinctions that a saint can have.
Next, we have Saint Therese, who is a great example of how our littleness and our imperfections can actually be our biggest strengths when given to God. Even as a feisty little child, she was destined for greatness, and she spent most of her life in a cloistered convent. But somehow to this day, she's the patron saint of missionaries because the power of her prayer and her trust and her admitting her littleness and imperfection has led her to be a vessel of truth and inspiration, and her prayers for the whole world are still felt to this day.
Yeah, next we have Saint Teresa of Avila, and she's also a doctor of the church, one of the female doctors of the church, which is pretty incredible. And she grew up and just wanted to be popular. She was a sassy little socialite child, and her dad sent her to the convent to try to whip her into shape. And she ultimately falls in love with the Lord and struggles in her prayer life, but through overcoming her struggles in prayer, she creates this whole teaching on mental prayer and how to engage in just the richest of prayer. And she helps revitalize the convent that she's a part of, which is the Carmelite order. And her teachings on prayer and her ferocity and how she tackled just reframing religious life and recommitting it to virtue is something that has still lasted throughout time.
Yeah, and then our last saint that we have up here is Saint Joan of Arc. So I think she's really cool, one, because she's young, and two, because she did some pretty crazy stuff. So when she was 13, she heard the voices of Saint Michael, Saint Catherine, and Saint Margaret telling her to drive the English from French territory. She went into battle with the men in armor, and she carried a banner encouraging them that it was God's will. However, she was captured, and she tried to escape, but she was sold to the English for 10,000 gold coins and was tried as a heretic and burned at the stake. But while she was being burned at the stake, she asked them to hold the cross higher so that she could see it amidst the flames, which I think is really crazy and cool. So she's a good saint for bravery.
Absolutely. So, we hear the stories of the saints and how their lives took all these unexpected twists and turns, but God used all of these women in their femininity for specific purposes to bring about greater change in the world and in their lives and the lives of the people around them. And they had all these goals and dreams that they presented to God, and God worked with them and used them. And so all this to say that God he hears you and he knows you, and he sees your goals and your dreams and what your heart desires, and he puts good desires on your heart, and he wants to bring these about. And this may be through pursuing higher education or getting a career and becoming a lady boss, like this cool little picture in the middle here, through your vocation, through being married or religious life or whatever that is, and starting a family. God works alongside of you in your life plan, and he takes into account everything that you're working towards and everything that you want. But alas, a goal without a plan is just a wish. And so we just really want to talk about how every choice you make contributes to this life plan, and that every choice has consequences, and that God gives you free will and a beautiful life to help co-create. And so we just kind of want to talk about the reality of this. And great. So I'm going to go ahead and hide our little video icons here. Sorry, as we move into our next segment. Okay.
So we want to put all of this in the context of choosing love. So first of all, what is love? Love is to will the good of another as other. So that means that it's not self-seeking. It's doing what's best for someone else, regardless of what that means for you, the inconvenience that it could be. So the ultimate example that we see of this is Jesus dying on the cross for us. He descended from heaven, which is the greatest place he could be, in order to suffer and die for us. So that is an ultimate act of love. But we want to emphasize that you still see love throughout your life. We orient our entire lives towards love. It's always what we're searching for and what we desire. So we see this in marriage, in religious life. We see this with priests, but we also see this in the smaller actions of, serving others, of volunteering at our church, of reaching out to those in need, and all those small acts of love as well.
Yeah, absolutely. Love has multiple parts, and we just want to break down the 3 different types of love. The first one is eros, and eros is sensual love. So this is a physical experience of pleasure, of positive feelings, of love, and this can include sex, but also beauty and art and the way that we experience the outside world, what we can see and taste and touch and feel, all of these things that contribute positive feelings and experiences. These are examples of eros. And quoting here, Pope Benedict from his encyclical letter entitled Deus Caritas Est, he says that love between man and a woman, which is neither planned nor willed, but somehow imposes itself upon human beings, was called eros by the ancient Greeks. So this is that kind of attraction, that physical love, that sexual love between man and woman. He later says, true eros tends to rise in ecstasy towards the divine, to lead us beyond ourselves. Yet for this very reason, it calls for a path of ascent, renunciation, purification, and healing. Pope Benedict is painting here that eros is good, and eros actually helps us understand that transcendence and God and that supernatural. But it's called to be purified and healed in order to really be understood in proper context of love.
So the next love is the agape love. That is sacrificial love, which involves acts of service and pouring oneself out. So this is kind of what I talked about with Jesus on the cross just a couple slides ago. This is a total gift of self and laying down your life for someone else. It's not about what you get, but what you give. So love now becomes concern and care for the other. It's no longer self-seeking or a sinking and intoxication of happiness, which is eros, like Kylie talked about. Instead, it seeks the good of the beloved. It becomes renunciation, and it is ready and even willing for sacrifice. So this is that sacrificial love, like the crucifixion, but also we see this in the Eucharist, right? The representation of the sacrifice of Jesus during the Mass. So this is what comes out of you, the gift of self.
And finally, we have philia, which is the love of friendship. And you have friends that you freely choose because of compatibility and common values. You get along really well. Jesus and his disciples are a great example of philia, of this love present in friendship. Jesus and his disciples, those were his ride or dies. Maybe you have your ride or dies, or those people that you would do anything for, and that you love spending time with. So eros and agape manifest in philia relationships and this friendship of love. For example, your spouse, whoever you end up marrying, if you do get married, that person will be your friend and you'll get to know as a friend before you end up having a romantic relationship with. And as a romantic relationship kind of blossoms, that comes from eros. It's that physical attraction that you have for that person, which is an added layer on top of that philia, friendship love. And in addition, agape love, maybe you have to drop everything and go help a friend that is in trouble. And so you're putting that person's needs before your own and sacrificing for that friend in a moment of need. And Jesus really sums it up perfectly here in the Gospel of John, where he says, greater love has no man than this, that a man lay down his life for his friends. So the root of love really is friendship. And we see with sacrifice and physical love and sensual love, because we do have physical bodies, we're embodied souls, that the human person experiences love in all of these complex ways, but it's always in the context of relationship with others. So moving into chastity. Chastity is a sub-virtue, so it's a virtue underneath temperance. And temperance, defined here from the Catechism, temperance is the moral virtue that moderates the attraction of pleasures and provides balance in the use of created goods. It ensures the will's mastery over instincts and keeps desires within the limits of what is honorable. So over created goods, like food, or kind of silly, but something like Netflix, something that is a good thing that we can enjoy and consume. But temperance ensures that we do it in moderation so that we don't indulge too much. And so in reference to sex, that's what chastity is related to sex and the virtue of temperance, in that chastity is the successful integration of sexuality within the person, and thus the inner unity of man in his bodily and spiritual being. Sexuality, in which man's belonging to the bodily and biological world is expressed, becomes personal and truly human when it is integrated into the relationship of one person to another in the complete and lifelong mutual gift of a man and a woman. So chastity is sexual integrity. It's the appropriate expression of one's sexuality and their sexuality being integrated into their whole person and all their faculties. And we have super cute picture of St. John Paul II up here, and he says about chastity that chastity is a difficult long-term matter. One must wait patiently for it to bear fruit, for the happiness of loving kindness which it must bring. But at the same time, chastity is the sure way to happiness. And every person is called to chastity in every state of life.
Yeah, so part of living chastity out is actually having emotional virtue, which is just purity in thought, word, and action. So women's deepest desire is to be loved. We think about it all the time, and often we fall into this temptation to emotionally use men. So we are trying to manipulate men to gain love from them, to gain attention from them, and get that emotional high. And sometimes we can do that in negative ways, by playing games or trying to offer ourselves, our body, in return for that love that we're seeking out. So part of this chastity, as integrating all parts of you, is integrating the emotional aspect as well, because that's part of love as well, and thus part of chastity. So continence is required in order to live chastely. So continence is chastity in action, and continence just means self-restraint from sex. So everybody is called to continence. Like Kylie said, everybody's called to chastity. So you have to live out chastity according to your state in life. So if you are single, engaged, married, if you are part of religious life and have taken a vow of celibacy, you are still called to restrain from sex in different contexts. So even if you're married and you have sex with your spouse, there are still times where you will be called to abstain and practice continence within your marriage.
So something that really relates all of these virtues together, temperance, chastity, continence, is the notion of free will. And the Catechism says here that by free will, one shapes one's own life. Human freedom is a force for growth and maturity in truth and goodness. It attains its perfection when directed toward God, our beatitude. So free will, why do we get the ability to make any choice we want to make pretty much ever, which is really daunting and scary. And sometimes I think it'd be easier if I could just have all my choices made for me, because decisions are really hard. Even like, what do I want to eat for dinner, or what movie do I want to watch tonight? Decisions are hard. But let's return to the origin of free will and try to understand why God gave us this gift. So we have to go all the way back to creation, into the Garden of Eden. So God creates Adam and Eve and puts them in this beautiful garden with all of these trees with delicious fruit. But he says, you can eat from every tree except for that tree right there, the tree of the knowledge of good and evil. And why the heck did he do this? Why didn't he just let them eat from every single tree and they could all live in perfect harmony forever and there would be no sin? Well, God had to give Adam and Eve the ability to choose to obey him in order to maintain a good relationship with him. If God didn't put that tree in the garden, they wouldn't have the ability to freely choose to be in relationship with him. And free will is absolutely contingent on true love, that you can't have true love without the freedom of choice, of freely choosing to put someone before your own needs and desires. So Adam and Eve had the ability to listen to God and know his wishes, and that he asked them to not eat of that tree, and they could have obeyed that and said, okay, yes, and chosen their relationship with him. But alas, we know how the story ended. That's not what happened. And free will is kind of a tricky, slippery slope, because sometimes we don't always make the best choices, but we can't know what it means to really love somebody without putting their needs before our own and making that choice with our own free will.
That's a really good point, Kylie. And so why are we talking about the human call to chastity and purity? Because we are all striving. We are not perfect. Sarah Swafford, who will be referenced again at the end of the PowerPoint, talks about emotional virtue and uses that line, striving, not perfect, repeatedly, because that's what we're here to do. We have to strive to be pure. Our human inclination after that fall in the garden is to sin, and therefore our natural instincts are not pure, but are faltered. As women, we can be mean or judgmental. Love between friends and in our relationships can be broken and weak. But when we keep our eyes on what's true and beautiful, we can spend our energy striving for good things without worrying about when we're not perfect. All that being said, today in our presentation, we're talking about a lot of issues that are difficult for some people because we may have made poor decisions in the past or decisions that we regret. Keep in mind as we present these things that we know that nobody is perfect and that many of you may be affected by these issues in your life. But by learning about them today, our intention is purely education, so that moving forward, as we all strive together, knowledge can be power, and our decisions can be based on truth and on educated beliefs.
Awesome. Thank you, Nellie. All right. So moving into rejecting the lies. We're going to start by talking about media, the social media, pop culture media, everything media related. You guys are probably on Instagram, Twitter, definitely TikTok. I see that one's really popular right now. Snapchat, YouTube, maybe even Facebook. All these different social media outlets that you engage on and receive images and content, in addition to the movies you watch on Netflix or different shows, even articles in magazines and things you might read online. All of these are examples of media, and where you're seeing certain images and ideas and thoughts and behaviors normalized, which influences your choices and how you view yourself. And so, you know, we see in media the perfect female body portrayed, and that we want to strive to have that perfect body. And so we try to portray a particular image in our own social media, so people perceive us in a certain way. And we can definitely fall into comparison. I wish I looked like her. I wish I had that house. You know, all of these images from media really influences the way that we see ourselves and the choices we make and what we think we should be doing. And don't get us wrong, news and social media, all these things keep us connected, and there is goodness in this, but there's also that danger of normalizing negative behaviors, of trying to keep up with an image that's damaging, and just falling into that comparison and thinking that you're lesser than others when that's not the case.
So something else that we want to talk about is pornography. I just want to say that we could do an entire presentation on this for hours and hours, and there are people that literally dedicate their life to talking about this issue, but we did want to touch on it. So it's something that we hear about a lot, but maybe don't know what the definition is. So we wanted to offer you this definition from the Catechism. So pornography consists in removing real or simulated sexual acts from the intimacy of the partners in order to display them deliberately to third parties. It offends against chastity because it perverts the conjugal act, the intimate giving of spouses to each other. It does grave injury to the dignity of its participants, the actors, vendors, and the public, since each one becomes an object of base pleasure and illicit profit for others. It immerses all who are involved in the illusion of a fantasy world. So we don't think that pornography is good for us because it treats people as if they are objects when people are meant to be loved and given as gifts of self. But pornography makes people into objects to profit off of in whatever way, shape, or form. So that being said, this is something that many people struggle with these days, especially with the internet and internet pornography being so widespread and readily available. But the world's most widely used medical diagnostic manual, it's called ICD-11, contains a new diagnosis that's suitable for porn addiction, which is called compulsive sexual behavior disorder. So we know that millions of men and women struggle with compulsive pornography use, and it's estimated that 40% of men and 20% of women are addicted to it. And this can include visual porn, chat rooms, erotic stories, and social media. So this isn't just a men's issue. This is a human issue that is happening right now. And we want to let you know that if this is something that is difficult for you and that you are struggling with, there is a really good website from Matt Fradd who speaks on pornography. It's called fightthenewdrug.org, and we will put that link up towards the end of the presentation.
So peer norms. Peer norms are normalized behaviors among your peers. And so it could include sex or alcohol and drug use, even just dating culture. You know, me and Nellie and Ariana were laughing earlier about when we were in high school and thinking about how the different phrases you would use when you like somebody, like we have a thing, or like we're talking, you know, just whatever we decide is normal with dating culture. That's collectively decisions that you make with your peers. What's normal, what's cool. And so ways that peers can influence your behavior are taking note of what others are doing, if they approve of that, and if they pressure you to do it. All of these things will strongly influence your behavior because you want to be accepted and you want to do what other people are doing. And this can all be encapsulated in the concept of FOMO, or fear of missing out. You've probably felt it. You see your friends post, they're all doing something really fun together and you're not there, and you feel this sadness or this exclusion, and you wish you were there and you could be doing what they're doing. And that's kind of what goes on in our brain when we're taking into consideration our peer norms and pressures we may be receiving from our peers to participate in certain activities. So we're now moving into a new section of the presentation, and we're going to be talking about the consequences of sex. We have this image right here, this fork in the road image, because like we talked about, God has an amazing plan for your life, and you have goals and dreams and places where you want to get to. And every single decision that you make is not arbitrary. It will either take you closer to that goal or it will take you farther away from a goal. And so we just want to paint that picture of that every choice that you make has consequences. And we're going to start by talking about the emotional consequences of sex. So emotional consequences of sex may include worry that you're going to get pregnant or an STD, maybe regret that things went too far and you didn't mean to take it there. You might feel guilt that you having sex was actually against what you believe or what you were hoping to do before marriage, and that you feel guilty for it, like you made a bad mistake. And damaged relationships inevitably happen when you have sex outside of marriage, because there's not that lifelong commitment present. And so it's that person can leave you, and there's really no harm, no foul sometimes, or the sex is just for use because you know you don't have that commitment. So your body is a union of body and soul. You're a human person. You are not just a body meant to just eat and sleep and have sex and go through this world just living as a presence. You have an immortal soul, and you're destined for relationship with God and eternity in heaven with him. And there are things that you are good at and that you are skilled in and that you think and feel. And this all makes up your soul and who you are. And so it's vital that you understand that when you have sex outside of marriage, it's separating your soul from your body. You're giving someone your body and not the whole other beautiful part of you, and you're letting yourself be used, and vice versa. When you want to have sex with somebody that you're not married with, you're saying, I want your body, but I don't want your fertility, or I don't want your soul or your hopes and your dreams and your wishes or your future. I just want part of you. And that's heartbreaking to realize too, because when we have sex with somebody, oftentimes we really care about them and you want to give yourself fully to that person. But that's why really only in the context of marriage is sex totally free, because you're actually giving your entire self, body, and soul to them for the rest of your life on earth. And so that's why having sex outside of marriage can carry emotional consequences because of this rupture within yourself.
In addition, we all know that sexually transmitted diseases, or STDs, are one of the consequences of having sex outside of marriage. And I don't know if you all have seen the movie Mean Girls, like Kylie and Ari and I have, but it makes me think that most of the time when we talk about consequences of sex, the quote from that movie is the first thing we hear, which is, don't have sex, because if you do, you'll get pregnant or you will die. And we're not here to tell you that today. What we're here to tell you is the truth about these issues that can be long lasting after a decision like that. But also, like Kylie was mentioning, that there's a time and place for sex and that it is meant to be free and good. So sexually transmitted diseases, as we probably have heard so far in health class or just in other education sources, are infections that can be transmitted through bodily fluids and contact with infected mucous membranes. So they can be either bacterial, viral, or protozoan, and we're going to go through those briefly now. So different types of bacterial STDs include chlamydia, gonorrhea, and syphilis. So the most prevalent of these is chlamydia. Gonorrhea is also prevalent, but more likely than chlamydia to be asymptomatic, so a little bit more hidden and easier to transmit for that reason. And then syphilis is unique on its own. We'll review this in a minute, but has different symptoms than chlamydia and gonorrhea. All of these STDs can be spread through vaginal, anal, or oral sex with someone who has it, and affects both men and women. Obviously, men and women are going to present differently symptomatically, but they are both affected and can both be carriers. So for women, symptoms of bacterial STDs include abnormal vaginal discharge, burning sensation when urinating resembling a UTI or a urinary tract infection. And if pregnant, a woman can pass chlamydia or gonorrhea to their baby during delivery. So it can be very dangerous if carried into pregnancy. Long-term consequences of bacterial STDs include pelvic inflammatory disease and ectopic pregnancies. And this is incredibly important to recognize because although bacterial STDs are among those that can be treated, and we'll review that in a moment, when not treated or when treated late, they can have effects that can impact fertility for a long time. Ectopic pregnancies are very high risk medical problems for women. They often require surgery and often require the cutting of one of a fallopian tube and can drastically decrease fertility moving forward. Pelvic inflammatory disease impacts your cycle forever and is also very dangerous, although less immediately life-threatening. So treatment for bacterial STDs, like any bacterial infection we may have, is through a course of antibiotics. Although those medications will stop the current breakout of the infection, they don't repair any permanent damage done by the disease, and if reinfected, you have to start another course of antibiotics. So bacterial STDs can be cyclical, and even when symptoms disappear, can sometimes have long-term effects. So syphilis, as I mentioned, presents a little bit differently than chlamydia and gonorrhea. Instead of burning when you pee and abnormal discharge, syphilis is spread through direct contact, but presents through lesions and sores in any part of the body that is contacted. So vaginal, anal, and oral sex will present differently when syphilis is spread. Again, affects both men and women, but there are different stages of syphilis that can affect different long-term impacts of the STD. Those stages are primary, secondary, tertiary, and latent. So primary would be the initial syphilis outbreak, sores at the site of the infection that are round and firm, but sometimes painless. So often people don't know that it may be syphilis or don't know what to do about it. Secondary syphilis will be spreading, causes a rash, and sometimes swollen lymph nodes in the area where the sores are present, and can also progress to resembling a fever or flu-like symptoms. And then a tertiary stage would be syphilis so severe that it's causing damage to nearby internal organs, or fevers that can be so dangerous as to lead to severe illness or death. And then the most important part of understanding syphilis is that there is a latent stage where people are asymptomatic and are just carriers of syphilis. And so this obviously can spread from one person to another very easily. Viral STDs are a little bit different, but still treatable. The first viral STD is actually not an STD, but commonly thought to be one, and that's herpes simplex virus, or HSV1. The first type of HSV is a cold sore that we've probably all had and probably all despise in one way or another because they're painful. It's a virus which causes outbreaks of cold sores in the mouth or nose, affects both men and women, and is often just easily spread by sharing drinks, cosmetics, or kissing. HSV2, on the other hand, genital herpes, is an STD and one of the most frequently seen STDs in the US. It's also spread through contact in vaginal, anal, or oral sex by someone that has the disease, and also affects both men and women. Symptoms in men and women are usually sores similar to a cold sore, but in our genital areas, and often progress to blistering. They can also be present in the rectum or the mouth. Often HSV can also be accompanied by flu-like symptoms, which is typically, unless the sores themselves are painful, the first sign that people recognize that they may have HSV. Treatment for HSV includes medications that are antivirals like acyclovir, more commonly known as Valtrex, which will resolve the sores themselves temporarily, but there is no cure for herpes. So much like the cold sores we experience in our mouth, they tend to come back. And same with genital herpes. It's a cyclical process that although they might not be present all the time, you can still be a carrier for HSV at all times. HPV is another one of the viral STDs, and there are hundreds of types of HPV. You may have heard of HPV already because at this point in high school, you may have already been vaccinated with a vaccine called Gardasil. Both men and women received that vaccine, and it actually is given to men and women to prevent the cancers that are highly correlated with HPV. What's incredible is that about 90% of sexually active people will have HPV at some point in their life. And 2 of the 100 types of HPV that are most common are over 70% correlated with cervical cancer. So cancer risk is very high with those who get HPV, which is why we have Gardasil. So HPV is spread through intimate skin-to-skin contact, through vaginal, anal, or oral sex, and affects both men and women, but it's really that risk of cancer that makes it so dangerous. Symptoms are similar to HSV, but the genital warts that are experienced with HPV begin as little papules, which are kind of resemble more pus-filled lesions, and they can often grow into clusters of lesions in different parts of the body that are contacted. They can appear on the hands, soles of the feet, rather unexpected places. So treatment for HPV, there is no cure, and especially if HPV becomes something more severe like cancer, clearly that's entering a whole new medical area that cure becomes a very complex thing. But HPV itself may seem to resolve spontaneously and, like HSV, come back in a cyclical process. If warts and papules that are experienced with HPV don't resolve themselves, there are gels, creams, other therapies, and laser treatments that can be used to get rid of them, or it may progress to needing surgery to remove them. Okay, and so finally, the last type of STD we're going to talk about, protozoal STDs. The only one we're going to talk about today is called trichomoniasis, which is a long word for an STD that basically resembles a yeast infection. So this is caused by a protozoan parasite called Trichomonas vaginalis, and it's the most common curable STD. And symptoms, like I said, resemble yeast infections. So they're cured the same way with a single dose of an anti-protozoal medication. Infection of these protozoan STDs is more common in women than it is in men. So symptoms include itching, burning, redness or soreness, discomfort with urination, much like a UTI, changes in vaginal discharge, and often women report a fishy smell associated with this type of infection. And again, a scary statistic, about 70% of infected people don't have any signs or symptoms and therefore don't know that they're infected. But that being said, can still feel the effects of long-term consequences of these STDs.
So our next consequence of premarital sex that we talk about is unplanned pregnancy. So in 2019, there were more than 170,000 babies born to women between the ages of 15 and 19. Nearly half of all pregnancies are unintended, and nearly half of unintended pregnancies occur using some form of contraception. And 83% of teen pregnancies cited alcohol as a key factor. So that draws back to our peer norms. So this is just to say that though you may be using contraception, that doesn't necessarily mean that you won't get pregnant and face an unplanned pregnancy.
All right, so we're going to start bridging the topic between unplanned pregnancy and abortion, because obviously A lot of unplanned pregnancies lead women to decide to abort. But before we get there, we're going to start introducing this idea of when human life begins, which is the most basic argument surrounding the topic of abortion and pro-life versus pro-choice arguments. So scientifically, life begins at fertilization, which is when an egg and sperm meet and form a zygote. At that time, through 8 weeks of pregnancy, the baby is referred to as a zygote before it becomes an embryo for the next 4 weeks, which is when it resembles a little tadpole, and then finally a fetus, which grows from 12 weeks until birth. So the anatomical truth of when life begins at fertilization is because that is when the genetic makeup of a human being, an irrepeatable, irreplaceable, genetically distinct human organism starts. At fertilization, the human being emerges as a whole, genetically distinct, zygotic living humanism, a member of the species Homo sapiens, needing only the proper environment in order to grow and develop.
So a woman in crisis pregnancy, in an unplanned pregnancy, pretty simply has 3 choices. She can choose abortion, adoption, or parenting. So we're going to break down these 3 options that this woman has to face when she's experiencing this unplanned pregnancy. So first, we're going to discuss abortion.
So the truth about abortion is that it's incredibly accessible in our time and in our society these days. Our society has almost made abortion normalized, but not many people know about the different types. So we're going to go through 3 different types of abortion and kind of explain what each one involves, so that in the spirit of knowledge being power, if you were ever faced, you or someone you know were ever faced, you'd be able to understand what an abortion is. So the first type of abortion is medical abortion. Medical abortion is a procedure that involves taking 2 medications in order to end a pregnancy and can be used in the first 10 weeks of pregnancy when the baby is a zygote or an early embryo. In taking these pills, there are 2 of them called mifepristone and misoprostol. The first stops the baby itself from growing by blocking the hormone progesterone, and the second causes cramping and bleeding, which empty the woman's uterus of the actual zygote itself. So what this resembles after taking the medications is somewhat like an intense period, because what the uterus does is just rids itself of the baby, the surrounding tissue, through intense bleeding. The Planned Parenthood website itself explains this process and says, for most people, the cramping and bleeding usually starts 1 to 4 hours after taking the second medication. And it's normal in that process to see large clots of blood, even up to the size of a lemon, or clumps of tissue. It's kind of like having a really heavy crampy period, but the process is also similar to an early miscarriage. This process itself is very dangerous for the woman and can last much longer than 4 hours, sometimes up to 24 or 36 hours. And with heavy bleeding like that comes with a lot of intense side effects and medical concerns. Notably, medical abortion is the only form of abortion that can be reversed, and we'll go through the next 2 to understand why in a minute, and that is known as abortion pill reversal. So abortion pill reversal is most effective when taken within the first 3 days of taking an abortion pill. And what it does is it floods the system with progesterone in the placenta, a large influx of progesterone to compete with the medication that was just taken to abort the baby. So although this comes with some uncertainty and is not 100% effective, it does increase the risk that the pregnancy could be saved versus aborted. And so a woman will continue to take the abortion pill reversal pill for the extent of the first trimester in order to flood her system with progesterone. The next type of abortion, which is used from that 8-week period up until 22 weeks when the baby is an embryo and an early fetus, is called suction abortion. And so this is a surgical process where a suction vacuum aspirator is used to remove the baby from the mother's uterus. And that being said, is not reversible. It comes with high risk to both the mother and the baby, especially when the mother experiences intense bleeding or when there's physical damage to the uterus and surrounding areas from the process of suctioning. There's also situations where they are perhaps unable to suction out the entire fetus and therefore will have to surgically remove it or escalate the surgery in order to remove. And finally, the last abortion procedure is called a D&E. It stands for dilation and evacuation and is essentially exactly as it sounds. It's used in later term pregnancies when there's a larger fetus present and involves using medical tools in addition to suctioning to dismember and remove the baby. At this time, the baby's too big to suction out just with the vacuum aspirator, so the baby is dismembered with the use of tools and then removed. Again, this is not a reversible process and comes with a lot of high risks for the mother and the baby. And additionally, one thing that we wanted to talk about that's a misconception about types of abortion is that miscarriage itself is also called abortion, but is not lumped into the same category as those abortions we just talked about, because it is a spontaneous abortion. And that's a medical term used to describe miscarriage. Miscarriage itself usually occurs in the first 12 weeks of pregnancy and is typically associated with a mother having other abnormalities in her health or comorbidities that are incompatible with life. Sometimes it can be the fetus or the baby that is having an issue incompatible with continuing to grow. Miscarriages themselves account for 50 to 60% of abortions. And so it is high risk for the mother and the baby and involves increased bleeding, but is not an intentionally induced abortion.
So is abortion a true choice? We're going to take a look at some statistics here. 73.8% of women who have had an abortion experienced some form of pressure to terminate their pregnancies. 58.3% indicated that they decided to abort in order to make others happy, and 30% admitted that they were afraid that they would lose their partner if they failed to terminate their pregnancy. So the majority of women who decide to abort are doing so because of influences from others, and that they are experiencing type of pressure in order to make this decision, which is the opposite of a freely made decision. And finally, multiple research studies show that women who have suffered an abortion have an increased risk of developing mental health problems, and that abortion can sometimes just intensify the trauma affiliated with an unwanted pregnancy.
Yeah, so let's look at some facts about the number of abortions. So 62 million abortions have occurred in the US since Roe versus Wade in 1973. Abortion is the leading cause of death worldwide in 2019 at 42 million deaths. And 1 in 4 pregnancies end in abortion. Of these abortions, 92% are elective, so they're done on healthy mothers with healthy children, and the top reasons that are provided are that they can't afford it, they're not ready, or it interferes with their plans. About less than 1% of abortions are due to incest or rape, and 7% are performed because of health concerns for the mother or the baby. And these statistics come from the Guttmacher Institute, which was originally the research arm of Planned Parenthood. So yeah, they're likely to be accurate, portray it accurately.
So moving into the next option a woman in crisis pregnancy will have, which is adoption. So we just want to talk about the truth about adoption and some things that maybe you didn't know. First, that open adoption is actually the only type of adoption that is permitted in the state of California, where there's the choice between the birth parents and the adoptive parents, that they get to mutually choose each other. That birth mother can go through adoptive couples to decide which seems like the best fit for her and for her baby. And that they can have a relationship, and that the child can know their birth mother or birth parents and their adoptive parents, and that there's open communication here based on the terms of the adoptive parents, and abiding to legality and what they've set as appropriate for their relationship. In addition, all pregnancy and adoption expenses, including attorney fees, are paid for by the adoptive couple. And there are actually 2 million couples eagerly waiting to adopt a baby at this time. So there's not a shortage of couples wanting to adopt. There are some wonderful adoption agencies and organizations here in San Diego that are resources for women that are looking to place their child for adoption.
So the other choice that you have in an unplanned pregnancy is to actually parent your child. This is definitely a challenge, but it's also a blessing, because parenting is really, really hard work, but it is also super rewarding. But I think that among women that are facing unplanned pregnancies, it's often thought that your life is over once you are in that position, and that if you choose to parent, you no longer get to do any of the things that you like. But your life doesn't end when your child's life begins. You will still have friends and family. Those relationships will definitely change. That's not to downplay it, but you still are able to do things with your child. And often friends and family will be more supportive than you thought of your pregnancy and of you carrying that child. And there are many organizations that can help you with parenting classes and resources, like COLF's, the organization that we represent. So there's definitely support out there to make the transition easier for you, because it is a difficult transition and something that is hard to do, but worthwhile.
So moving into fertility and contraception.
So when talking about contraception, it is important to acknowledge that our fertility is a gift as women to us, not a disease. And so there is a way of looking at our fertility as a good thing that we can learn and understand and use to our strength. And there's a way to treat our fertility like a disease by trying to alter or stop it, which is where contraception can sometimes be in place. So different forms of contraception that exist are oral contraception, injections, and IUDs, all of which work to provide synthetic hormones to prevent ovulation, thin the lining of the uterus, and change the consistency of cervical mucus, or prevent implantation of a fertilized egg. The most common of these being oral contraceptives, which in our society are also used for things other than preventing sex, and sometimes are prescribed for regulating a cycle or for treating acne. Overall, the side effects of artificial birth control are tremendous. There are a long list of side effects because they all affect our hormones and therefore have many effects on our body, including weight gain, acne, blood clotting, irregular bleeding, headaches, depression, mood swings, nausea, abdominal pain, and then longer term consequences like pelvic inflammatory disease, allergic reactions, increased risk of heart attack, stroke, and increased risk of cancers. So a lot of contraceptives can prevent against pregnancy, but contraceptives do not protect against STDs. And that is because, as we discussed earlier, STDs are spread through contact. So no form of contraception is 100% effective against both unintended pregnancies and STDs. In order to prevent STDs, there needs to be a barrier between contact, which is where other forms of contraception come into play. So another form of contraception is called Plan B, or the morning after pill. This medication is called levonorgestrel and is a form of emergency contraception that's very accessible in our society. This pill is taken within 72 hours of having sex by creating an influx of hormones that makes a uterus a less effective environment for implanting or fertilizing an egg and sperm. Plan B is often claimed to be about 75 to 89% effective, and this is because there are a lot of circumstances that make it less effective. So first, Plan B is less effective depending on which part of your cycle you're on when you take it. That's because our cycle is regulated by various different hormones, and so when we implement the new hormone, levonorgestrel, into our cycle, it can be more or less effective depending on how much progesterone or estrogen exists at that time that you take it. Second, Plan B is a very low dose of that hormone, and so it can be less effective for women who may be over, say, 150 to 155 pounds because it's just not a therapeutic amount for their body size. And lastly, this pill is not effective to abort an already implanted pregnancy, and so if it's taken after pregnancy occurs, then it's not effective at preventing it. Plan B can cause alterations in a woman's normal cycle, and often the period or periods occurring after taking the Plan B pill can be heavier or lighter, unexpected, totally missed, and so it does have effects on a woman's cycle.
So the Catholic teaching on contraception, artificial birth control used for the purpose of contracepting life is not permissible in the Catholic Church. The Church affirms that the purposes of sex are procreative and unitive. Procreative meaning openness to life, and unitive meaning bonding of the husband and wife together for greater intimacy. Contraception blocks the procreative function of sex, which is unnatural to the foundation of marriage, which is total gift of self. So like I was saying earlier, it's sex with contraception is here's my body, but not my fertility and not my soul. It's cuts off the purpose of that total gift of self that is intended in marriage. And natural family planning is the preferred method of regulating births. Ari, if you want to talk a little bit about natural family planning.
Yeah, so natural family planning is just tracking your cycle and the different changes that are associated with your cycle each month in order to tell when you're fertile or not fertile and adjust your actions accordingly within the context of marriage. So your cycle is just that, it's cyclical. So you can see patterns and figure out what's going on with your body by the signs that you're seeing and tracking those signs.
So hand in hand with natural family planning, in recent years, there's been developed a type of medicine called naprotechnology, natural procreative technology. And this is a health science that monitors and maintains women's reproductive and gynecological health in the context of the body being whole, but centered on the idea that we can understand our cycle. It provides medical and surgical treatments that cooperate completely with the reproductive system. And therefore, naprotechnology, for example, if a woman in our time who's trying to fight an outbreak of acne doesn't want to go on the pill or the contraceptive form of the pill, they can use other forms of understanding her level of hormones by tracking her cycle, and then in the context of naprotechnology, can find different ways of treating that acne by focusing on the hormonal imbalances that are causing it. That's just one of the many examples that by centering on our reproductive health, we can understand lots of other effects in our body. There's a quote here by Dr. Monique Ruberu, who is a NAPRO physician out of New York, and I had the pleasure of hearing her speak last year. And she said, "Unlike the typical GYN, I don't pride myself in covering up symptoms with the use of contraceptives, but instead I just glory in the idea of naprotechnology and how it allows me to truly understand the underlying issues behind medical issues and then how to address them." So one additional note about taking birth control is if you're hearing our presentation today and you're thinking, oh my goodness, I've been taking birth control for years. I didn't know this. I didn't know about this. I just want to say that, we also have been there. And when I was in high school, I was prescribed birth control, just as I had mentioned just now, for acne. I had a whole lot of acne in high school, and my dermatologist, the first thing they went to was putting me on the pill to regulate my cycle and my hormones. At the time, I did not know at all about other options that are out there. And so if you're finding that, if you're hearing what we're saying and you yourself are using contraception and want more information about it, we just want you to know that there's no shame in that, and that now if you're having more thoughts or questions regarding what you may be doing or taking, that's the time to seek more help, seek more education, and we are here for you in that.
Yeah, absolutely, Nellie. So here at Colf's, we offer fertility care with NAPRO technology. Our physicians are trained in NAPRO, and they will help you identify different fertility or hormonal issues using this technology. We also offer pregnancy tests and ultrasounds, STD testing. We do offer abortion pill reversal procedure. Nellie was talking about the abortion pill reversal earlier, and we do receive patients in our clinic who are seeking abortion pill reversal after they take that first abortion pill and are in the window of being able to reverse that with the progesterone treatments that we're able to provide. And finally, we offer client advocacy. We provide our clients with holistic care in physical and medical care, but also just emotional and mental care. And we like to provide them with all the support that we can. And if they need extra resources in education or material support, whatever our clients need, we really try to provide the most holistic care that we can at Colf's. We have 2 clinic locations, one in Mission Valley and one in Escondido. And we also offer medical fee assistance for those who don't have insurance and might need help paying for their medical services. We're able to offer help for that as well. So kind of jumping back here, just claiming the truth about everything that we have talked about. First and foremost, you are a beloved daughter of God.
Yeah, and there's nothing that you can change, that you can do to change your inherent worth and dignity.
As women especially, our sexuality and our fertility are gifts from God that are unique to us.
It's never too late to start over or redirect your life.
And God has an amazing plan for you, and that will never change.
And as we were just touching on, regardless of your history, your previous choices, or where you may be right now, you are loved, chosen, and cherished.
Committing to virtue. Like we talked about at the beginning, God has an amazing plan for your life, and He calls us to excellence in consistent pursuit of that goal and plan, and developing our skills and time and talents so that we can grow and reach these goals by striving for excellence. Committing to temperance, maybe cutting back a little bit on Netflix, or not having that extra Reese's peanut butter cup, or whatever temperance looks like for you. But just being self-possessed over your body and your appetites and your desires. And committing to chastity, striving for that sexual integrity and that sexual integration, understanding and embracing your sexuality and your state of life right now, and living in that appropriately and accordingly. And committing to continence, if you're single, self-restraining from sex, and choosing to live out chastity in that way. And emotional purity, choosing purity in words, thoughts, and deeds, and really seeking to love others before yourself and to put their needs before your own, living that great, beautiful agape sacrificial love. So that is the end of our presentation. I'm gonna peek our faces back in so we can say bye. We just want to say thank you guys so much for listening. We hope that you got good information out of this, and if there's any questions that you have, we'll make sure to include our contact information, especially for Nellie, our friend here, who is a nurse and very knowledgeable. I know she'd be very happy to chat with anyone about any of the medical stuff. And then Ariana and myself, who work in ministry for Colf's, and are also here for questions. So we have our supplemental resources here too, just different pro-life resources that we've referenced, and we have other ones too that we can provide. So thank you so much. We're here for you, and God bless.